police officer, the night that my son had his psychotic break, they found mostly dab marijuana in his car. And he said, we see this all the time, these psychotic breaks from the dabbing marijuana. There was a social worker that had to interview my son before he was admitted to the behavioral health hospital. And we spoke with her after and had a conversation, and she said 90% of the psychotic breaks, especially recently, that she's seen in the emergency room are from dab marijuana. The next day when he was admitted to the behavioral health hospital, we were speaking with the admitting nurse. And he said, I wish I could say that this situation was uncommon, but we see this all the time from dabbing marijuana, these psychotic breaks. And then there was the psychiatrist that we spoke to at the end of the week, and she said the dab marijuana is leading to these psychotic breaks. This is happening all the time. She also said, I wish I could say that this was an isolated case. She said, but it's not.
So we need to call, our medical professionals, and I know a lot of them are speaking up, but we need them as a community, as a society, with their organizations, all the law enforcement, anybody who is on the front lines who sees this, to stand with the parents, because the parents are trying to do everything we can to bring light to the truth to what the effects of marijuana is. So we're calling the medical professionals, the law enforcement, to stand with us, to educate our lawmakers and tell them to quit protecting this predatory marijuana industry that's really damaging our children.
Right. And I'm even remembering now the paramedic, we had to go in an ambulance ride. My son was transported from the hospital to the behavioral health hospital, from the ER to the behavioral health, and even the paramedic said, oh, we're seeing this all the time. So we need to get out and interview the medical professionals, the law enforcement officers. I have a friend who's a police officer, and she's speaking out about marijuana because she sees that is frontline causing so many, she's on the front lines and it's causing so much damage, so many psychotic breaks, a lot of violence. So those are the people that need to be interviewed because they're seeing it. It's not, sometimes the parents aren't ready to talk about it, but the people just dealing with the emergency service professionals, they see it all the time.